Good evening to everyone, and welcome to today's sessions hosted by Council of Academic and Medical Education's South Indian Medical Student Associations. So today we are here to present a webinar on UDHAS, Understanding and Demystifying HIV, AIDS, and STI. I'm Abhishek Velmurugan, Council Vice Chair. Today we have an amazing team to present this webinar. I'll now ask our presenters, the Council members, to introduce themselves.
Hello everyone, good evening. This is Hasya Singham Setti, a council member of COMI SIMSA and an MBBS third year student from SWIMS SPMCW Tirupati, Andhra Pradesh.
Good evening everyone. This is Pradyumna Krishnadas from KIMS Bangalore and I am a COMI member SIMSA.
Hello everyone, this is Rachna. I am a final year medical student from Mallareddy Medical College for Women and I am a council member of Council on Medical Education, SIMSA.
Okay, so before we start the event, I would like to go on over a few items at a few points. If you have any doubts or query, you can just comment on the chat box in the YouTube links, or you can use our WhatsApp group to ask your queries and doubts. We'll be solving all the doubts and queries at the end of sessions. So before we start the session, before we start the webinar, we have a short video to show you people about HIV, AIDS, and how it's transmitted.
HIV stands for Human Immunodeficiency Virus. It works by attacking the immune system, the very thing that stops us getting sick. HIV targets CD4 T cells in the immune system, cells which usually coordinate our body's immune response. The virus takes over these cells and uses them to make copies of itself. Over time, HIV kills more and more of these CD4 cells, weakening the body's immune system and its ability to recognize and fight infection. If HIV isn't controlled by treatment, eventually the body becomes unable to fight off serious opportunistic infections, including tuberculosis, leukemia, pneumonia, and Kaposi sarcoma. It's these opportunistic infections that can cause death. Many people confuse HIV and AIDS. HIV is the virus that attacks the immune system. AIDS is the set of symptoms and illnesses that are a result of an immune system seriously damaged by HIV. AIDS is now more commonly called late-stage HIV. There's no cure for HIV, but antiretroviral treatment stops the virus from replicating and damaging the immune system. A person living with HIV who's on effective treatment can live a long and healthy life and never progress to late-stage HIV. How do you get HIV? HIV can be found in blood, semen, breast milk, vaginal fluids, and anal mucus. It can be passed on when these fluids enter into another person's body, for example, through sex. The virus in someone's vaginal fluids or semen can pass into their partner's body through the mucous membrane of their vagina, anus, or the top of their penis. Once the virus is in their blood, it makes copies of itself. HIV can also be passed on from mother to baby during pregnancy, birth, or breastfeeding, or by sharing injecting equipment. It can't survive outside the body. You can't get HIV by touching, hugging, or kissing, from coughs or sneezes, or sharing food. You can protect yourself and others from HIV by using condoms, taking PrEP, and not sharing injecting equipment. If you're HIV positive, taking treatment reduces the amount of virus in your body. Treatment can lower your viral load to undetectable levels, meaning you can't pass HIV on. If you know how you get HIV, you'll know how to protect yourself. How does HIV treatment work? Antiretroviral treatment for HIV uses a combination of drugs, which together stop HIV from making copies of itself. This keeps the amount of virus in the body low and the immune system strong. Treatment doesn't cure the virus, but it does keep it under control. control. Some people achieve an undetectable viral load, which means that the virus exists in such small quantities in their body that it doesn't affect their health, and there's zero risk of passing it on. A viral load test can confirm this. The most important thing is that a person keeps taking their treatment as prescribed by their health professional. If someone stops taking their treatment, their viral load will go up again. Without treatment, people living with HIV get sick because their immune system is damaged by HIV over time. A healthcare professional should monitor treatment progress regularly. They can help manage any side effects and make changes to treatment if needed. Treatment options are always improving and becoming easier to take. Effective treatment means that people living with HIV can lead long, healthy lives.
Okay, so after going through this video, coming to this question, is HIV and AIDS the same thing? It's very obvious that HIV is the causative agent. It is a virus which causes the terminal disease called AIDS. Now let's go in detail about them. Can we go to the next slide, please? Yeah. So what is HIV? H stands for human, that because it infects the human beings, and I stands for immunodeficiency because it decreases or weakens the body's ability to fight off the infections and illnesses. Whereas V stands for virus, it is a pathogen having the ability to replicate only inside a living cell. And how many types of HIV viruses are present? There are mainly of two types. And HIV-1 is the most common in sub-Saharan Africa and can be found throughout the world. And it again consists of groups called M, N, and O. The pandemic is mainly dominated by group M. And in turn, this group M is comprised of subtypes from A to J. Whereas the HIV-2 is most often found in the Western Central African parts of Europe and India as well. Now let's see the structure of HIV or the AIDS virus. So it consists of an outer lipid membrane and two envelope proteins, namely GP120 and GP41. It also contains P17 matrix proteins, and inside there is a conical capsid, which is made up of P24 capsule proteins, which in turn encloses two copies of single-stranded RNA with some enzymes, namely reverse transcriptase, integrase, and proteases.
Now let's see what is AIDS. AIDS, acquired immunodeficiency syndrome. Acquired means to possess something new. Immunodeficiency means decrease in body's ability to fight against infections. Syndrome is a set of signs and symptoms that occur together to characterize a particular abnormality. AIDS is the final stage of the disease caused due to the virus called HIV. In this stage, there is highest viral load of HIV, which causes drastic decrease in the CD4 cells of our body, which thereby decreases our immunity and drives way for opportunistic infections. Next slide. Now, HIV versus AIDS. HIV is the virus that causes AIDS, which means AIDS is the last stage of the infection caused due to HIV. Not everyone who is infected with HIV has AIDS, but everyone with AIDS are definitely infected with HIV. So, AIDS is the result of the progression of the HIV infection. And something that is important is anyone infected with HIV, although if they are healthy, they can be a potential transmitter of the virus to the other person. Coming to the life cycle of HIV, any virus, including HIV, cannot replicate on its own. It needs to enter into a living cell, use its mechanisms to make copies of the virus. So HIV, like we have already seen, has glycoproteins on its envelope. HIV basically targets CD4 cells, T cells or T helper cells and monocytes of our body. Those CD4 cells and T cells have certain receptors called CCR5 or CXCR4 receptors. The glycoproteins of the virus bind to the receptors of CD4 cells and fuse with the cell. After fusion, the virus penetrates into the CD4 cell, and then it uses its enzyme called reverse transcriptase to form a copy of DNA, which also replicates and forms a double-stranded DNA. And using the enzyme called integrase, this double-stranded DNA of the virus gets integrated with the host cell's DNA. Along with the normal replication process of the host cell, these virus particles also replicate and multiply within the cell. And these viral proteins thereby assemble at one place and push the cell membrane of the host cell and form a bud. This is how budding takes place, and the virus is released into the serum.
Okay, now let's see what are the clinical manifestations of HIV and AIDS. So clinical manifestation of HIV and AIDS includes four steps: initial infection, asymptomatic carrier states, AIDS-related complex, and AIDS. So what happened in the initial infections? So basically when anyone is contacted with HIV virus, the body start developing the antibody against it. So you'll have some sort of antibodies present in your body which react with this virus. So you have basic symptoms like cough, cold, you can have headaches, you can have sore throat. So these are the initial infections that can occur. The second stage, asymptomatic carrier state. So it can last like from few months to few years. It has also been noticed that a person with HIV, they can be asymptomatic for like more than 10 or more than 12 years. In this stage, what happens, the virus present in the body is started replicating inside your body, but because of some higher amount of CD4 or T cells, we don't have any symptoms. Then after comes the third stage, that is AIDS-related complex. So it is before when the actual AIDS started. So you can have the symptoms like malaise, weight loss. That is the most common symptoms that can be seen for HIV patients. You can have lymphadenopathies, that increase in swelling of lymph nodes, and some other manifestations. And the final state of HIV infection, that is AIDS, which is incurable, and like you can have all those symptoms with decrease in immunities, and you can have opportunistic infections. Um, so these are like some of the following symptoms that can be followed like 3 to 6 weeks after the primary infections. For example, like systemic includes fever, weight loss. Centrals that affects your brain, you can have malaise, headache, and neuropathy. In lymph nodes, you can have swelling of lymph nodes. In skin, you can definitely have rashes. In mouth, pharyngitis, so throat ulcers. You can have myalgia, you will have enlargement of spleen, and you can have like liver enlargement. And the basic symptoms associated with all the period of this disease, that is nausea and vomiting. Then what happens that HIV infections antibody response? As I told you earlier, that at the starting the first stage, at the initial stage, so you'll have like flu-like symptoms. So you'll have this HIV infection, that is the red color you can see, like you'll have the entering of the virus in your body. At the same time, so you'll have the sudden production of antibodies. But after like 2 to 4 weeks, what happened? This virus decreases, but the thing is like the virus will replicate inside your body, but you won't have that symptoms present, and you'll have increase in CD4 counts. That's why this is not a symptomatic or like asymptomatic state or intermediate latent state. So after a long year, like after 10 to 15 years, what happens? The virus again started increases in your body, but it had that much ability that he has already destroyed the CD4 cells. So your immunity became low, and the virus started increasing. And this causes like AIDS-like symptoms. That is the final stage. Now let's see what the relation between the CD4 counts and different type of infections. Okay, so at the starting initial months, as I told you, like there's a decrease in CD4 counts, and again there will be increase. So there's a less chance of like any type of infection occurring at the starting period. But as the year increases, like 3 years, 4 years, 5 years, and 10 years, your CD cell counts, like the cells which is required like to fight with any type of infections or something, that started decreasing. So you can have like there's a chance of like more infections. For example, like you have histoplasmosis, you have toxoplasmosis, there's a chances of cytomegalovirus disease, and you can have like higher chance of getting acquiring with tuberculosis, and pneumonia also can occur in the different stages of life. So like starting you won't have any symptoms, but the end, like after 10 to 15 years, you'll have started developing the main symptoms as your immunity decreases.
Okay, guys, I'm going to be speaking about how to get HIV. Listen, guys, this is very important. The fact it's very how to say it, it's that it's a common misconception that we get HIV through different routes. But there are some routes which are true, but then there are some people who think that comes through kissing, or it, like, yeah, it might come, but then that's not much important. The main ways in which HIV is found in the following bodily fluids are blood, especially, and semen and pre-seminal fluid, pre-cum, rectal fluids or anal mucus, vaginal fluids, breast milk, and saliva. You can see those colors in next to that, the image. These are the abundance in which they are found. Blood is highly abundant in the HIV numbers. So getting infected through blood is having highest risk of having HIV symptoms, and it in turn converting into AIDS. Next slide, please. These are the ways in which you can get HIV transmitted to you by another person. Having sex without a condom, this has been like a large alarming thing, especially in our country like India, that sex without a condom is like a crime, I guess. But no, it's fine. You need to have sex with a condom. That way you are actually going to prevent unwanted pregnancy, and along with that, you are going to be preventing STIs. Those are sexually transmitted infections. Not only HIV, there are many other. We're going to be talking about them later. You're going to be preventing them too. And then it can be passed from mother to baby in case the mother is HIV positive, and during delivery the virus can be transmitted through to the baby because of mixing of blood and other ways. And sharing injecting equipments, guys, this is very important, considering facts like drug abuse, intravenous drug abuse, and all that. First of all, drug abuse itself is a wrong thing. Along with that, sharing needles like this is much hazardous because we don't know if the other person is contracted with HIV. So it's like, yeah. And then contaminated blood transfusions and organ transplants, these can also transmit HIV. That way, hospitals should make sure that blood transfusions are safe and they are hygienic, they aren't contaminated. And even organ transplants, nowadays there are high precautions taken in case of organ transplants, but still there is a high chance of acquiring HIV. Next slide, please. How do you get HIV from sex? Okay, HIV is transmitted to semen, vaginal fluid, blood, and anal mucus. There are different ways of having sex. Now, there are types: anal sex, oral sex, and all that. And then each way has its own way of transmitting HIV to the other person. During sex without a condom, the bodily fluids from one person can pass into the body of their sexual partner. This can happen through the mucous membranes of the penis, vagina, and rectum, or sores in the mouth and throat. You can only get HIV from someone who is living with HIV and has a detectable viral load. See, guys, as I mentioned before, the bodily fluids have HIV, and then as shown in the video too, they need to have detectable levels of HIV in their bodily fluids so that it is transmitted to other people. Do some types of sex have more HIV risk? Yes, anal risk and HIV are highly associated with each other, and even oral sex. There are things used by people: sex toys, fingering, fisting, and HIV, kissing, and HIV, other factors. Each of them have their own prevalence in contracting HIV from another person. Next slide, please. Okay. Condoms protect you from HIV, other sexually transmitted infections, and unplanned pregnancy. Yes, look, these are the advantages of using a condom while having sex. So it's actually made mandatory by the government, and then it's actually being given free. Like you might know Nirod, it's actually given free to people in villages and all by our country's government. So it's very important to know this. Next slide, please. How to get HIV from injecting drugs? Yeah, sexual intercourse is the most common and important way of transmission of HIV, but these are other ways in which you can contract HIV. Injecting drugs: during an injection, some blood goes into the needle and syringe. A needle and syringe that someone living with HIV has used can contain blood with the virus in it after the injection. Guys, it is pretty obvious. If you are using a needle which another person is used to inject drugs within themselves, there is a sure shot thing that you're going to be transmitted with HIV if that person had the virus circulating in their blood. if yeah, can I get HIV from any type of injecting? There are many ways you can get actually HIV from injecting drugs and the equipment used to inject drugs, including preparing drugs with syringes that contain infected blood. Wherever there is involvement of infected blood, there is high chance of HIV transmission. So it's better to avoid such things and actually maintain a proper hygiene in cases of hospitals, or in case of injections which are self-administrative, like some doctors, they tell people to administer themselves. Please don't share such syringes with anybody else. Please use it yourself. Like sharing water used to flush blood out of a needle and syringe, yes. And reusing bottle caps, spoons, or other containers to dissolve drugs into water and to heat drug solutions. Reusing filters, normally small pieces of cotton and cigarette filters used to filter out particles that could block the needle during an injection. Even that can transmit HIV to you. And unsafe disposal of used needles or syringes. Disposal of needles and syringes itself is like a big topic, and then it involves bio-waste management and all that. And even that, those protocols should be followed in case we need to have safety among us from contracting HIV. Next slide, please. Using clean needles protects you from HIV, hepatitis C, and other viruses. Like I told you, HIV is not the only disease you can prevent from actually using clean needles. There are many other diseases you can prevent. So try maintaining a hygienic process in anything. Next slide, please. How is HIV transmitted from mother to child during pregnancy? This is one of the most important topics, because you see there are already so many dangers to a pregnant mother, because she's already having low immunity. Upon that, if that mother has HIV positivity, that means that her immunity is too less, that it's going to be affecting not only her but also the baby. Pregnant women living with HIV, there are a number of ways that HIV might be passed on to your baby. HIV in blood could pass into your baby's body. This is most likely to happen in last few weeks of pregnancy, during labor or delivery. That is because the blood mixing has a high chance at that point of time. Breastfeeding your baby can also transmit HIV, because HIV is in your breast milk. See, as soon as the baby is born, the mother is supposed to start off breastfeeding, and that too for a minimum of 6 months. And in case she doesn't know herself that she has HIV within her blood or in her bodily fluids, it is like pretty impossible for us to tell that she's actually doing like a dangerous thing to her own baby. There is a 15 to 45% chance of passing HIV onto your body if neither of you take HIV treatment. However, taking the correct treatment during your pregnancy and while you breastfeed can virtually eliminate that risk. Next slide, please. Taking treatment properly during pregnancy and breastfeeding will keep your baby free of HIV. First of all, pregnancy itself is a immunodeficient state. You're going to be on a lot of medications at that time. Along with that, you have to be making sure that you're taking proper medicines if you have HIV in your blood. So that way you're going to be preventing the risk for your baby. Next slide, please. Can HIV be transmitted through blood transfusions? Again, since I was speaking about how blood itself, when it remained in those syringes and then some other person uses the same syringe, it's going to be harmful to the person. Just like that, while doing blood transfusions, when somebody donates blood and then they don't know that they're HIV positive, and then that blood is given to somebody else, they're going to be HIV positive too. But then the worst thing about HIV is that you won't know it for like maybe 5 to 10 years, and then you're going to be knowing it then. So that way you can't even tell how you contracted it from or where you got it from. So that's like another minus point in case of HIV. In the unlikely event that a person who is HIV positive donate blood products that are not tested, the person who receives the blood product is likely to develop an HIV infection too, as I told you guys. In order to prevent this, international health regulations require all blood products, such as organs or tissues, to be screened for a number of viral or bacterial contaminations before they are used. During the screening process, any blood products that contain HIV, hepatitis B, hepatitis C, or syphilis, which are also as deadly infections like HIV, they are going to those bloods are going to be disposed of. This means that the transmission of HIV through blood products is very rare, but examples have occurred in some low-income countries where lack of equipment to test all blood. There, they might show some carelessness by not testing all blood samples before donating it to some other person. That way, HIV contraction has a higher rate. If you're thinking about donating blood but are not sure about your HIV status, you have to request an HIV test in advance of donating at your local clinic. See, guys, first of all, donating blood is a good thing. You guys have to be motivated to donate blood. But then in such cases, you're going to be demotivated that, yeah, I did a good thing donating blood, but then I had HIV, and then now it's a problem that that blood can't even be used to be given to someone. That's the reason we need to be precautious about our own health, and then we need to get HIV tested even before it's too late. Next slide, please. If you are unsure, ask if the blood transfusion you have received has been tested for HIV. It's important, guys, for you to know what do you mean by being unsure, because like you might not see any symptoms of that. So you have to make sure, and you have to be true, faithful to your doctor, telling about your previous sexual activities, and then has it happened with a condom or without a condom, or did you have any recent blood transfusions or drug abuse and all that. In case you're not revealing such sensitive topics to your doctor or anybody, that case you're gonna be having HIV, and then you're gonna be giving it to some other people too. It's very important to actually be open about it. Next slide, please.
Okay, so coming to the question, can I get an HIV test to use at home or in a private location? Yeah, the answer is yes for this. And these are known as HIV self-tests, and they are of two types mainly. One is a rapid self-test and the other one is a mail-in self-test. So what is this rapid self-test? It is done entirely at home or in a private location, and it can produce results within 20 minutes. And you can buy this test kit at a pharmacy or online. The only rapid self-test currently available in US is an oral fluid test. Whereas coming to the mail-in self-test, it includes a specimen collection kit that contains supplies that collect dried blood from a finger stick at home. The sample is then sent to a laboratory for testing, and the results are provided by a healthcare provider. And this mail-in self-test can also be ordered through various online merchant sites. Your healthcare provider can also order this test for you. So what should you expect when you use a rapid HIV self-test versus what should you expect when you use a mail-in HIV self-test? So coming to the rapid test, for this test, you must use a swab and swab your gums to collect an oral fluid sample and use the materials in the kit to test your oral fluid sample. And you will be getting the results within 20 minutes. And then if your test result is negative and you haven't had a possible exposure during the previous 3 months, you can be very confident that you don't have HIV. Whereas if your test results turns out to be positive, you have to go to a healthcare provider for a follow-up testing. And what should you expect through mail-in HIV self-test? There are many mail-in self-testing services available through online merchants. The kit you receive provides you the tools and supplies which you will need to safely prick your finger and collect a very small sample of blood on a card. The sample is then mailed to a laboratory for testing. Again, if you are tested positive, you will have to go to a healthcare provider for the follow-up testing. And if you are negative and you are sure that you do not have any exposure during the past 3 months, you can be very confident that you don't have HIV. So summarizing the differences between rapid self-test and mail-in self-test. So you can order both these tests on your own, and your healthcare provider can order it for you only in case of mail-in self-test, whereas the rapid self-test, it's your choice. And the rapid self-test is available at a pharmacy, whereas the mail-in self-test is available only online. The rapid self-test is again available online. Whereas coming to the test which will give you a quicker result, it is rapid self-test. Like we already discussed, it will give the results within 20 minutes. And this rapid self-test sometimes can find HIV soon after exposure, but mail-in self-test can immediately find it after the exposure. So which uses the oral swab? As we already discussed, rapid self-test uses the oral swab, whereas the mail-in self-test uses the blood spot. And sometimes these both tests are covered by insurance, health savings account, and flexible spending account.
Now, what is HIV stigma? HIV stigma is negative attitudes and beliefs about people with HIV. It is the prejudice that comes with labeling an individual as part of a group that is believed to be socially unacceptable. HIV stigma is still persistent, though there has been a great progress in access to HIV testing and treatment. Here are few examples of HIV stigma. Believing that only certain group of people can get HIV, like gay men or immigrants or black people or sex workers or lorry drivers or people who inject drugs. We have an assumption that these group of people are only susceptible to HIV, but unfortunately HIV can also pass from a mother to her child, where the child doesn't belong to such group. Even unknowingly, HIV can pass through blood transfusions where the victim is not belonging to such groups. Another example of this HIV stigma is making moral judgments about people who take steps to prevent HIV transmission. In fact, this is something that actually has to be appreciated rather than judged. Another example of HIV stigma is feeling that people deserve to get HIV because of their choices. We are actually living in a society where we have very strong ethics and codes in in terms of our culture and social beliefs, especially in regard with our sexual activities. So we assume people who actually have a great sexual exploration to have a dirty lifestyle, and we believe that they deserve to get HIV because of those choices. HIV stigma does not just include these. It also refers to misconceptions about HIV and AIDS. It also refers to believing in myths in regard with HIV and AIDS. So HIV stigma is something to be actually spoken about. Now, what is HIV discrimination? While stigma refers to the attitude or belief, discrimination is the behaviors that result from those attitudes or beliefs. HIV discrimination is the act of treating people with HIV differently from those without HIV. And now, here are a few examples of HIV discrimination. A healthcare professional refusing to provide care or services to a person living with HIV. Another example is refusing casual contact with someone living with HIV. Like we have already discussed, touching a person with HIV or shaking your hand or hugging them or sitting beside them does not at all transmit the virus to you. Another example of discrimination is socially isolating a person of a community because they are HIV positive and referring to those people as HIVers or HIV positive people. People also have like they discriminate people using verbal taunts, or they gossip about them, which is actually something. HIV stigma and HIV discrimination are something actually to be spoken about. What are the effects of this HIV stigma and discrimination? The stigma actually leads to the major thing that it leads to is discrimination. It also leads to harassment and abusement of HIV positive people. It leads to physical violence also, and it leads to very limited access for them to different kinds of healthcare services, or also social, economic, and legal services. All these are interconnected and will lead to poverty and sickness of that person. This is the summary of global HIV epidemic by the end of 2019. By the end of 2019, there are 38 million people living with HIV. And in the year 2019, there were 1.7 million newly affected people with HIV all over the world. And in the year 2019, there were 690,000 deaths recorded due to HIV. And coming to the gender ratio, men were more infected with HIV in the year 2019. And also, there were children below 15 years who were also infected with HIV. And the research shows that 150,000 children who were below 15 years of age were also infected with HIV. This is the status of our country. We have a prevalence of 22% in our country of HIVs, people living with HIV. And there are around 60,000 AIDS-related deaths in our country in the year 2019. The highest highest state with people living with HIV is Maharashtra, followed by Andhra Pradesh, then Karnataka, and so on. This is our progress towards the global target 90-90-90, which actually meant that 90% of people living with HIV should know their status, and 90% of people should receive treatment, and 90% of people should achieve viral suppression. We are in a progress which says that 79% of people living with HIV are aware of their status, out of which 71% of them are receiving treatment, and we are at a progress of achieving viral suppression as well. This is the new global target which says 95, 95, 95. This means that 95% of people living with HIV should be aware of their infection, and out of which 95% of them should receive treatment, and 95% of them also should achieve viral suppression.
Okay, guys, so safer sex. Keep calm and condom on. So, this is actually a very important topic considering the stoppage of transmission of HIV. And as my friend just told here, the global goal is 1990, 95, 95, 95. So, we need to achieve that. If we need to achieve that, we have to follow certain precautions, which one of them being that you need to use a condom every time you are having sex so that you can stop the transmission of STIs and HIV. So what is a male condom? That's a question we need to answer certain people, because there are a lot of places who wouldn't know what it actually means. So imagine there are actually big villages which have all of this population who doesn't even know what it means, so just far away that they even use it. So what is a male condom? Fluids such as semen, vaginal fluids, and blood can pass on HIV and STIs. An external or male condom is a thin piece of rubber worn on the penis during vaginal, anal, or oral sex. It creates a barrier to stop these fluids from entering the body. Most male condoms are made from latex, that is rubber. So this acts like a barrier such that it stops the fluids from passing from one person to the other. Why should it be used? They work really well. When used correctly, condoms provide excellent protection against HIV, pregnancy, and most STIs. In fact, they are the only type of contraception that allows stops you getting or giving STIs. Yeah, there are other contraceptives, but they're not as effective as this when it comes to stopping the transmission of STIs. A few STIs can be passed on simply through skin to skin contact, for example, genital warts. But condoms also cut the risk of many of these. Next slide, please. Yeah, how to use a male condom that's external. So step one, remove the packet, tear it, and then remove the condom from it outside. Step two, you place it over your penis, the distal end of your penis, and then roll it, slide it slowly down, and then after it's done, you can actually apply or not go for it. It's a lubricant, you can go for it, or like just like that. And then after it's used, you have to put it again in the packet, and then you have to safely dispose it. Next slide.
So now, after learning about male condoms, now let us learn something about female condoms. So what is a female condom? It is worn inside the vagina or anus to create a barrier to stop bodily fluids and semen from entering the body. And they are made up of a soft plastic material called nitrile. Though these are called female condoms, they can be used by people of any gender for protection during anal sex. And why should it be used? Again, they also work really well. And when used correctly, they provide excellent protection against HIV, pregnancy, and sexually transmitted infections as well. In fact, they are the only type of contraception that also stops you from getting the STIs, including HIV. So what are the steps and how to use this female condom? The first step, carefully open and remove the female condom from the package to prevent tearing. Then there is a thick inner ring and a thin outer ring. So the thick inner ring with closed end is used for placing in the vagina and holds the condom in place. The thin outer ring remains outside of the body, covering the vaginal opening, as shown in the picture. Then find a comfortable position. So while holding the outside of a condom at the closer end, squeeze the sides of the inner ring together with your thumb and forefinger and insert it into your vagina. It is similar to inserting a tampon. Then now use your finger and push the inner ring as far as possible upwards so that it will rest again as the cervix. The condom will expand naturally and you may not feel it as well. So be sure that your condom is not twisted and it's uniform. The thin outer ring should remain outside the vagina and you must be able to see it. Now guide a partner's penis into the opening of the female condom. Stop the intercourse if you feel that penis slip between the condom and walls of your vagina, or if the outer ring is pushed into the vagina. So how to remove this now? So to remove this, gently twist the outer ring and pull the female condom outside the vagina and dispose it properly.
Okay, so we have already learned about like what is male and what is female condom. So there's sometimes a chances like during your sexual intercourse, the chance of breaking the condom, so like it just spills out and goes away. So what are the steps to perform like whenever your condoms break or it spills away? So like there are simple steps which you can do to prevent like HIV or like some type of infections once the condom breaks. The first thing, like if it happens during an intercourse, just withdraw your penis immediately, then remove the cum or the semen as soon as possible, like as much as you can. Then gentle wash the outside of your genitals. See, you have to make sure that you should wash the genitals outside. If you wash it like inside your vagina or inside your anus, what happens? It's like further cause of like irritations and the chance of infections that can go through it. So if you're having a vaginal sex, so go to the bathroom and pee the flush away all the semens as possible, like as much as you can. If you are not using any contraceptives to prevent pregnancies, like you need some emergency aid and like what, and you have to be precautive like within 72 hours of like having a sex. And if you're having a oral sex and suddenly the condom breaks, you have to spit out all the semen and rise in your mouth with water, but make sure that you do not brush off within like 1 hour. See, these are some basic management you can do with your own, like with yourselves. So after this things, like this thing requires that you have to get tested. So if you're unsure that no, like you can have a chance of infections, like you are at a risk, visit a healthy facilities, and like you can have the test like at least the time between when you have a sex and like when you go to test should be at least at 10 days. If you're worried about the symptoms, because after the 10 days, like there's a more chances that this virus can be detectable in your blood. Okay. So there's also chances like alcohol, drugs, and sex and HIV. Okay. So this is one of the main important topic that the youth in our generation should be considered, because if you're taking drugs or alcohol, what happen? It suppresses your brain and like it won't you won't know like what are you doing when you're intoxicated or when you're in drugs and alcohol. So sex can be pleasurable, but the thing is like you should be make sure that you're going it right and you have the get good protections and everything. So don't forget to use an external condom or an internal condom whenever you are alcoholic, whenever you are alcohol with alcohol, if you're taking drugs. So if you're not realized, like if someone you're wearing condoms, so it can break off and so these are the things that can happen when you are like in a drugs or when you can have in alcohol. You don't know like what you're doing, whether you're wearing condoms or not, whether the condoms had already broken or like it just split off. Okay. If you are in drugs, like you are in a mood of like hallucinations and like you want in a mood to take consent, or like you want in a able to talk with your partner like whatever sex you want, or like whether you need the protections or you don't want protections. Okay. And there's chances like during your alcohol or drug, like somebody has spiked your drinks, that can also the increase of getting some STI and HIV if you're not doing protections. And most of the cases that we can see during alcohol and drugs, like is like injection of needles and like use needles, as one of my friends already explained, like injecting needles and using drugs can also increase the chance of HIV, right? So during alcohols and during taking the drugs, so this type of things can also chances the risk of HIV. So many of this behavior increases you getting the STIs actually, and sexual transmission infections and including HIV. So what are the safer way if you're partying and like you don't want to get HIV or like you don't want to get STI? What are the things you can do? See, if you know that you're going party and you're gonna have sex, always carry a protection with you and a plenty of lube. You should be aware of your HIV status, because that's important. Because if for your HIV positive, and like if you're doing sex with knowingly or unknowingly, it can affect other people. So it's better to know your HIV status, and like you should have a test in between. So party with the people whom you trust. That's one of the main thing that you can do. Set your limit. Be clear, like what kind of sex you want and what kind of activity you're indulging in. If you are in alcohol, just stay away with the drugs, or like make sure that the right drugs like you are taken. But it is recommended not to take that. And like if you are in some pre-exposure prophylaxis, or like if you're taking some antiretroviral treatment, so don't forget that you take and you go to a party. Okay, so one of the most important things we can see here nowadays, that is what is chemsex. So chemsex, that is basically using some sort of drugs which enhance your sex activity, like that long time period of your having sex. Usually people like uses drugs to increase their pleasure, to increase their physical sensations, or like to have that sex for a long lasting performance and everything. But the thing is like the chemsex can also increases the vulnerable of having HIV and STI. So the people though, there's a scientific experiment that can also be that already have been done, that gay men's like often they're using this chemsex, they're using some types of drugs or some types of medicines to enhance their sex performance. So what are the types of drugs which we are using for chemsex? So the three most important that can be seen, that is gamma hydroxybutyrate or gamma butyrolactone, or it can be like mephedrone, or it can be crystal methamphetamine. So these are the three common drugs that people are taking. So these drugs can be taken individually, or like people who are in alcohol, they can take these drugs by mixing of this. So what are the risks? As I told you, like it can also increase the risk of getting HIV. Other thing is like it can also have STI also. So what are the points you need to keep on mind? So with the physical inhibitions, you're less likely to use condom, right? So if you're having in a drug, so if you're in alcohol, so there's less chance you're using a condoms. You may not remember like what you have done or whether you have used a condom. Yeah, that's true. You won't remember like you have actually used condoms or not. So if you're using that chemsex, okay, so if you're taking any medications, so you want you to be go for long lasting sessions, okay. In that time, you will forget to use a pre-exposure prophylaxis or medication which you are taking, which actually prevents you from HIV, and you're not using a condom at that time. If any person is like living with HIV, and if you forget to take any medications, this chemsex can let that HIV to pass from like one person to another person's. During chemsex, if you are like highly, if you want to have a sex, you can have a sex with strangers, and like you can hook up with the social media partners, anyone, and you can have a multiple partner. This can also have increase the chance of HIV. You may have some forceful sex between like some peoples with the help of these medications. And if you have this forceful sex, like if you have anal sex or vaginal sex, so this will lead to a destruction of your like internal membrane, like internal lining of your anus or vaginas. And you can have like high chance of HIV, STI, including hepatitis C. And if you're having a long session, you forgot to take your emergency post-exposure prophylaxis, which can actually prevent you from HIV. And if you're using these drugs by injections and everything, and there's a chance like you can share your needles, right? So in that way also, like you can have an increase the chance of HIV. So I have talked before like PrEP, that is post-exposure prophylaxis. What is that actually? Suppose if you're HIV negative and if you're having a sex, or like you don't like with whom you're gonna have a sex, okay, right? So these are some sort of medications which are taken by HIV negative to prevent from HIV infections. So currently there's only one drug which is approved by FDA, that is Truvada. So this Truvada is a pill, is a single pill which a combination of like anti-HIV drug, tenofovir and amictriptyline. So these are two drugs which are combination which you can found in Truvada, and this basically prevents you getting HIV. That's why this is like pre-exposure prophylaxis. But you should not be confused with the post-exposure prophylaxis. So post-exposure prophylaxis is a type of medication which you are taking after the sex, not to contact, like not to have HIV. Okay, so pre-exposure prophylaxis and post-exposure prophylaxis. And how this pre-exposure prophylaxis prevents you from HIV? The anti-HIV drugs stops the viral replication. Okay, we have seen it about the viral replication process. Okay, once a virus replicate to your body, it will generate a new types of virus, and hence the virus increases. So this pre-exposure prophylaxis stops that thing at the initial phase, so that once the virus enters in your body, you won't have any chances to replicate that virus. It will destruct that virus at that moment of time when it enters the body. So no virus, that means you don't have, so you have like 0% chance or like low percent chance of getting the HIV. So people may ask you like how effective is pre-exposure prophylaxis? Yes, if you use it like continuously and if you are taking it regularly, like definitely the pre-exposure prophylaxis is 100% guaranteed, like you won't have any HIV. This also a question arises that if I take pre-exposure prophylaxis, can I stop using condom? See, it's up to you. You don't know like people is having HIV or people can have STI. So these are two different manifestations you can have with the people. People can have STI but they can't have a virus, HIV virus, right? So if you're using pre-exposure prophylaxis, it's only prevent you not to get HIV. But if you are not using condom, there's a chance that you can have skin to skin contact. You can have that fluid contact. So there's a chance that it can transmit that STI. So pre-exposure prophylaxis will give you guarantee like you won't have HIV. But if you're not using condoms, definitely there's a chances that you can get STIs such as chlamydia, hepatitis C. And the thing is like the one of the most advantage of using condom, that is not having STI and not to prevent you from unwanted pregnancy, right? So if you want to use condoms, there's a chances of having a pregnancy after the intercourse, but PRP doesn't take a responsibility that it will prevent the pregnancy. So it's better if you are taking that PRP course, it's better to use condoms to prevent the other type of diseases. Okay, so who can take pre-exposure prophylaxis? So basically, the people with HIV negative, like, and the people who are like in more risk, they can get this. So it is a good options if you're like having ongoing sexual relationship, or like if your viral load is undetectable. That means the virus present in your body is very low. If you're a gay or if you're a bisexual, and if you're having multiple partners, and if you don't use condom all the way, it is like one of the best way to prevent from HIV. And if you aren't aware of your HIV status of your partner, you can use this. Then if you are injecting, like if you are having money, like sex for a money, or like if you are receive gift, like if you are receiving some gifts, like after when you do sex and all everything. So this is one of the way that you can prevent. And one more question arises: is PrEP effective from vaginal anal sex? Yes, you can take this both if you're having both anal and if you're taking that vaginal sex. So both can be prevented if you take these medications. So how to take this medication? So you are taking this medication as a single tablet per day. For it can be recommended for both women. Okay, so women, men's, transgenders, and cisgenders. Men who are having male vaginal sex and anal sex with women's, or it can have for like gay and bisexual. So whoever wants not to have HIV, they can take this. So what are the things need to consider if you're doing this? You should need to take this pre-exposure prophylaxis for 7 days before you're protected, and then like every single pills, and how long you want to continue your protections you have to take. And you can take based on the demand of the event and whether you need to take it before or like after the planning of the sex. These are the things like we need to take care if you're having sex, and like if you want to take this pre-exposure prophylaxis before having your sex.
Okay, now we have another important topic that we guys wanted to discuss, that is STI. What does STI stand for? It stands for sexually transmitted infections. What is a sexually transmitted infection? It is an infection transmitted through sexual contact. So, STIs can be passed on when you have unprotected sex, or if you are in close sexual contact or intimate physical contact with someone who already has an STI. Unfortunately, most STIs have no symptoms or may only cause very mild symptoms. So, a person can have an STI but may not know it. Hence, if you feel you have contracted any STI, get tested. How can someone get an STI? Just like the HIV, STI also follow the similar routes. One is vaginal intercourse, or anal sex, or oral sex, or transmission from mother to a baby during the child birth, or also through skin to skin contact, or by using sharing equipment like needles. It can also pass through bodily fluids. These are some symptoms of STI. Female symptoms include increased vaginal discharge, vaginal itching, burning or pain when peeing, pain during sexual intercourse, bleeding between menstrual periods, pain in lower stomach, lumps, bumps, or sores. When it comes to male, the symptoms include watery or cloudy discharge from the penis, burning or itching around the tip of penis, frequent peeing, testicular pain, burning pain when peeing, lumps, bumps, or sores.
Okay, so now we have discussed about what is STI. Okay, so there's a something, the word which is called as abstinence. Okay, so what is abstinence, and like what are the effective way, like what is the most 100% effective way to prevent yourself from STI and pregnancy? Okay, so abstinence means like no, no, don't do anything or nothing to do with something. Sexual abstinence means to like having abstinence, like absence of any type of sexual activity. So this can be like having avoiding any types of vaginal intercourse, like having any types of sexual activities or any anal intercourse, avoiding genital contact. So if you won't have any contact or if you won't have any sexual activity, so there's a 0% chances that you are getting STI, you are getting HIV, and like you are the least bother with that risk of pregnancy, right? So abstinent means not having sex with anyone, including vaginal, anal, or any types of intercourse, or even with a genital contact. So we are discussing about STI, right? So what are the different types of STI? So there are three classification of STIs. The STI, which is caused by bacteria, which is caused by parasite, and third one, which is viral. Okay, now discuss about the bacterial STI. So bacterial STIs are normally curable. This includes chlamydia, gonorrhea, and syphilis. Let us see what is chlamydia and what is gonorrhea. Okay. So chlamydia, these are basically a bacterial infections of genital that can lead to pelvic inflammatory disease in women. And sometimes it can cause infertility also. Same thing as like gonorrhea. This is also a bacterial infections. It may be occurs in genitalia, it can be occurs in throat, anus, and it also leads to infertility in women. So the way of transmission of this chlamydia and gonorrhea is similar. So having a vaginal anal sex, you can without a condom. Yeah, the condom is like the things which you need to take. Right? Without having a condom, if anyone is having a sex, it may be vaginal or anal sex. There's a chance of getting a transmission of this chlamydia and gonorrhea. Another thing is like if a woman is pregnant or like if or during a delivery, it can pass from mother to baby. So there's an intrauterine transmissions from a mother to baby of both these type of infections. So what are the symptoms? So both this disease starting, you won't have any symptoms, but you can have a pain in your lower abdomen, or when you're having a sexual intercourse, you can have a pain. You can have a bit pain in your like lower part. So in women's, there's like you can see that there's a difference in menstruation pattern, and you can have a bleeding patterns. And men's also, they don't have any symptoms, but they can have like water or thick discharge from their penis and pain while urinating. So there's like some of the most common symptoms that can be observed. But basically at the initial stage, the stored disease are like asymptomatic. What is the treatment of choice? So treatment is basically start with like using the antibiotics. So antibiotics is the best thing that you can do, and it's a like curable STIs. And what that a partner can do. So recent sexual partners who can, they can think like they can have this type of diseases, they should undergo a treatment, and they have to make sure that you can take the current course of antibiotics, and like you don't have any type of sexual intercourse once you started your treatment, right? That's one of the most important things. So these are illustrations of like chlamydia infections. You can see that you can have like vaginal discharge, and that can be present in that both male and female genitalia. So these are the clinical pictures. You can see like this. One is like penis, and you can have some types of like some, you can see some spots. Like this is some basic clinical manifestation that you can see. You can see that why is discharge from vagina. This is like one of the most clinical main clinical manifestations that you can see in chlamydia. Now gonorrhea. So gonorrhea also same thing. This is also like bacteria, and you can have the same clinical presentations. So in this you can see like different penis. You can see like vagina. You can see like whitish, yellowish, greenish. It's ever discharge. So discharge, it may not always be like water. It may not be like whitish. If you have like more infections, like if it's like over for a long period of time, you can have like greenish type of discharge also. It can also other manifestation you can see, you can have some papules on the skins and you can have some rash also. Now coming back to syphilis, the third STI, bacterial course. So this bacterial infections, this basically enters your body by breaking your skin or lining your genital areas, and as the time goes, it spread not only to your genital, not only to your internal organ, but there's chances that it can spread to your heart, brain, and spinal cord. So you can have like CNS associated with syphilis, some heart diseases which is caused by the syphilis. How do you get that? So basically, same thing. STI occurs from vaginal or anal, or it can occurs with the oral sex if you're not using condoms, or like if anyone gets infected. It can also cross from like mother to baby across placenta during the pregnancy. If this type of syphilis occurs, this is known as congenital syphilis. So what are the main clinical like symptoms you can show? So you can see the different types of ulcers, usually in the genitals, other part of the body. And later what happened, it spreads, right? It spreads to internal organ, it spreads via like blood and everything. So you can feel some swollen glands, you can see rash, you can have like hair loss. What is the treatment? Same as the another one, you can have like antibiotics. But the thing is, like if you have a syphilis, make sure that you can do a blood test after once your treatment is finished. This ensure that like you won't have like 0% chance of recurring of these infections. And the sexual partners who has already got the syphilis, they should must undergo treatment if they have found it positive. And you should have a good regulation advice that no sex, you shouldn't have any sex until the syphilis is clear. So these are like clinical manifestation illustrations you can see, like you can see this type of lesions in the penis and vagina. See, as I already mentioned it, this you can have at a primary, secondary, tertiary syphilis. You can have some sort of like ulcer type. It can be seen in mouth. It can be seen in like lower part of the bodies, in the legs, in the area of genitals, and it can be seen in your mouth also, like in your lips. This is like one of the main clinical presentation that you can see with syphilis, and it can be spread. This type of skin lesions can be present all over your body, at your back, at your abdomens also.
After bacteria, we need to move to parasitic infections that are transmitted sexually. These three are one of the most important parasitic infections transmitted, namely pubic lice, scabies, and trichomoniasis. Next slide, please. Yes, this is the theory behind these infections. Pubic lice or crab's lice, the causative agent is called either of them. They're small lice that live in the pubic hair and cause irritation. How do you get it? By close bodily contact, usually during sex with an infected person. Can be spread via infected bedding and clothing too. So make sure you maintain your hygiene everywhere. And symptoms include intense itching in the pubic area, small nits on pubic hair. These pubic lice, what they do, they attach themselves on the pubic hair, especially, and then that causes the itching. Treatment includes special shampoo, cream, or spray applied to pubic area. Wash all clothing and bed linen. And partners should be told, should also be treated of the last 3 months in the same way at the same time. This is how you go along with pubic lice. Trichomoniasis. It is caused by a causative agent known as Trichomonas vaginalis, which is a small parasitic organism which causes irritation in the vagina in women and can cause an irritation inside the penis in men. And this happens during sexual intercourse with an infected person. And symptoms, as I told, includes irritation, and along with that, women may not have any symptoms. In fact, they might actually be like carriers. They can only have the causative agent, but there may be a yellowy green frothy vaginal discharge. This might be seen in women, and men usually have no symptoms with this. Treatment include antibiotic tablets and or vaginal pessaries. And partners, they have to take care by treating themselves with antibiotics too, and to avoid reinfection. Don't have sex until 7 days after starting treatment and until sexual contacts have been treated. This is common thing between any sexual transmitted infections, that you shouldn't have sex for at least a week since you're taking treatment. Next slide, please. Yeah, these are the images of the causative agents. Pubic lice, that's how they attach to the pubic hair, and that causes severe itching. And then they might also attach to the skin and causes redness. And trichomoniasis, These are the lesions you might see in the vagina. Next slide, please. Again, these are the pictures, and these are the live images of what they can do. Pubic lice in the pubic area and trichomoniasis. As I told you, this is a yellowy, frothy discharge that might occur in women. Next slide, please. Yes, this is another disease known as scabies. These are small mites that burrow into the skin, which causes irritation, like in the case of trichomoniasis too. How do you get it? By close bodily contact, sometimes during sex. Can be spread by sharing clothes or bedding, same thing. And symptoms include itching, worse at night, and a rash on the body. Treatment: special lotion, cream, or ointment to get rid of the causative agent, and wash all clothing and bed linen. Partners should also take treatment of the last 3 months in the same way at the same time. Next slide, please. Again, these are the manifestations of scabies. You might see like these raised red color papules, maybe over your back or like your hand, on the abdominal area. These can be scattered and then all over the skin, and you have to make sure that you find these findings in yourself in case you are infected, and start the treatment as soon as possible before it spreads through all of your body. Next slide, please.
Okay, so now let's learn about the viral causes of STIs. They include human papilloma virus, herpes, hepatitis, and HIV. So first talking about HPV virus, which is human papilloma virus, they usually cause genital warts. They cause fleshy or flat lumps, which may be present even if they are not visible. And how do you get it? They are transmitted by direct skin-to-skin contact, usually during sex, and from mother to baby. Sometimes no identifiable source of transmission can be found. And the clinical manifestations include fleshy or flat lumps on or around the genitals, anus, groin, or thigh. And the treatment modalities are like visible warts can be treated, but the infection cannot be cured. On 1st January 2017, HPV immunization became free for everyone, male and female, aged 9 to 26, including the non-residents under the age of 18. And how can you protect your partners? The condoms provide some protection, but not total. Coming to the genital herpes, which is caused by herpes simplex virus, and it can cause a skin infection, usually on the mouth and lips. They are also called as cold sores, or on the genitals. How do you get this? This occurs by close skin-to-skin contact with someone with the virus, and also from mother to baby. What are the clinical manifestations? They include painful red blisters, little sores or ulcers, and also flu-like symptoms, and sometimes a discharge as well. And the treatment modalities, again, it is anti-herpes drugs and pain relievers can be given to treat the symptoms, but the infection cannot be cured. Some may need medication to prevent the further progression. Also, condoms can be useful in this case as well, but they cannot offer complete protection. And you shouldn't have sex when the sores are open. And this is a human papilloma virus illustration. And these are the live examples where you can see dermatological manifestations on the skin of hand and genital areas. This is about genital herpes again, illustrations on genital herpes. Again, these are the blisters which are red and painful. You can see on various regions of your body, on mouth and genital areas, etc. Now coming to the hepatitis. Hepatitis A, B, and C, which are very similar in terms of symptoms and all. So this is a viral infection which will mainly affect your liver. And how do you get it? It is mainly through contaminated food or water, or not hand washing after toilet, before food, etc. It can also be transmitted through anal sex and oral to anal contact like rimming. And the symptoms include, they can mostly be asymptomatic, but sometimes mild flu-like symptoms can be there, vomiting can be present, abdominal pain, dark urine, and yellowing of the skin and whites of the eyes can be present. Treatment includes the immunization for prevention, good hygiene and hand washing, avoid alcohol and drugs, and eating a well-balanced low-fat diet. You can protect your partners by going through immunization for prevention and avoid anal sexual practices until you're recovered. Coming to hepatitis B, You can get it through having vaginal, anal, or oral sex without a condom with someone who has the infection, or it can transmit from mother to baby by sharing the needles, syringes, toothbrushes, razors, and unsterilized instruments which pierce the skin, and also via blood transfusions. Again, the symptoms are similar to the hepatitis A. Treatment for hepatitis B include rest, exercise, avoiding of alcohol, drugs, and smoking, eating a well-balanced low-fat diet, and also check any prescribed or over-the-counter medicines if they are safe to use. You have to always use a condom if your partner is not immunized, and protection is offered to the babies on the immunization schedule and to children under 16 years of age. Free immunization is available for household and sexual contacts. Coming to hepatitis C, uh, this also you can get it via contact through infected blood or by sharing needles or syringes or possibly through sexual contact. Blood transfusion in countries that do no pre-test blood for transfusion. And the symptoms include, again, they may be asymptomatic or mild flu-like illnesses, including vomiting, abdominal pain, etc. The treatment is similar to hepatitis B: rest, exercise, and avoiding of alcohol, drugs, and smoking, eating a well-balanced low-fat diet. Sexual and needle sharing partners can have a blood test to check for hepatitis C antibodies. So we have learned already a lot about HIV, and just summarizing about this, it is transmitted through bodily fluids like blood, semen, and vaginal fluids, and via sharing needles and from mother to baby as well. Blood transfusion in countries that do not do the pre-test is a main thing we have to concentrate on. And the symptoms, there are usually no obvious symptoms for many years. Treatment, there is no immunization or cure available, although some secondary infections can be treated or prevented. Keeping well for longer as possible with good care. Women with HIV or AIDS need a cervical smear yearly, every year. And you have to practice safer sex to prevent the transmission. Partners should ask for an HIV test.
National AIDS Control Program. This was launched in 1992 by the Government of India. This program is a comprehensive one for prevention and control of AIDS. It is globally acclaimed as a success story. National AIDS Control Program has 4 phases, and each phase is a 5-year plan. In 1992, NACP-1 was implemented with an objective of slowing down the spread of HIV infections so as to reduce morbidity, mortality, and impact of AIDS in the country. It was implemented by National AIDS Control Organization, popularly called as NACO. NACO is an autonomous organization which, in collaboration with other governmental and non-governmental organizations, provides leadership in ensuring access to every person who is infected with HIV. In 1999, NACP2 was launched with 2 key objectives. One was to reduce the spread of HIV infection in India, and two was to increase India's capacity to respond to HIV or AIDS on a long term basis. In 2007, NACP3 was launched and was aimed at halting and reversing the HIV epidemic in the country. NACP 4. This is the last phase by the NACP, which was launched in 2014. It has 5 major components. Component 1 is intensifying and consolidating prevention services with a focus on high-risk groups and vulnerable populations. They had targeted interventions with peer-led approach to high-risk and vulnerable groups. They have concentrated on condom promotion, treatment of STDs and linkages. They have ensured blood safety, HIV counseling and testing, mainstreaming. Component 2 was expanding information, education and communication services for general population and high risk groups as well. Component 3 was providing comprehensive care, support, and treatment. They have provided free antiretroviral treatment. There was treatment for opportunistic infections, including tuberculosis, leprosy, also. They have provided psychosocial support to HIV infected and affected persons as well as their families. Component 4 was strengthening institutional capacities, where they have increased national, state, district, and national, state, and district building capacities. They had projects and financial management, and they had supply chain management. Component 5 was strategic information management system, which by which they have strengthened surveillance, research, program monitoring, data analysis, and dissemination. National Strategic Plan for HIV or AIDS and STIs during the years 2017 to 2024. The Sustainable Development Goal 3, which is concerned about health and well-being. The National Strategic Plan for HIV or AIDS and STIs is under the Sustainable Development Goal, which has 5 objectives and 5 respective outcomes. And they also have 5 priorities, and this is a fast track approach. They wanted to ensure that we pave way for a HIV and AIDS free India. Now, where can someone go for STI testing and treatment? You can consult your family doctor, you can approach a walk in clinic, or also a health unit which has STI clinic. 3 things that you should know about HIV treatment are: HIV medicines cannot cure HIV, but they help people with HIV live longer with healthier lives. People with HIV take a combination of HIV medicines every day. The HIV medicines prevent HIV from advancing to AIDS. HIV medicines reduce the risk of HIV transmission. To conclude, make HIV care and treatment a part of your daily routine. Keep your medical appointments and take your medications as directed to stay undetectable. Thank you.
Um, Thank you so much, guys. That was a very wonderful presentations. Thank you so much. Yeah, I guess we have covered all the points and we have covered all the queries regarding the HIV, STIs, and like other different modes of transmissions, contraceptions, and everything. So if anyone has any further doubts or queries, they can ask us in the YouTube live now. Like we have our separate WhatsApp group for this event, or you can mail us in the Komi Simsa websites, or you can follow us, or whatever things you need to require about like HIV or anything else, we are ready to help you guys. So once more, thank you so much to all the speakers, to all the presenters who present these wonderful presentations, and thank you so much.
Thank you, everyone. Have a nice day.
Thank you for watching us today live. Thank you.
Thank you, everyone.